Today I'm going to be teaching about sepsis and septic shock in adults. Sepsis is a life-threatening organ dysfunction that is caused by a dysregulated host response. Septic shock is a subset of sepsis in which circulatory, metabolic, and cellular issues are profound enough to substantially increase the risk of mortality. The pathophysiology of sepsis is that it can occur as a complication of any infection of any body tissue. The infection is characterized by a triggering of a large systemic inflammatory response, which leads to a variety of adverse events for the patient. Some of these include vasodilation, which leads to hypotension, increased capillary permeability, and hypercoagulability. Other cells are then activated that typically help the body during immune or inflammatory reaction. These cells are platelets, neutrophils, macrophages, and endothelial cells. In sepsis, the action of these cells is overexaggerated and uncontrolled and sparks a systemic immune and inflammatory response. The etiology is that infection that leads to sepsis begins with septicemia, and sources of infection can be bacteria, viruses, and fungi. Bacteremia is the presence of bacteria and their toxins in the blood, which is a common cause of sepsis. It is also most often the result of a patient afflicted with a gram-positive infection from Streptococcus and Staphylococcus bacteria. Typical portals of entry that may lead to septic shock are urinary system, respiratory system, gastrointestinal system, and tegumentary system in the female reproductive system. Risk factors. Risk factors that predispose someone to sepsis include malignancy, chronic kidney and liver disease, use of corticosteroids, immunosuppressed state, burns, major surgery, trauma, presence of indwelling catheters, hemodialysis, and extreme age. Prevention. For individuals with cancer or other immunosuppressive processes, especially those undergoing treatment with chemotherapy or radiation therapy, they must be carefully monitored for sepsis manifestations and may be placed on prophylactic antibiotics because of the high risk of infection. Complications from pneumonia are a major cause of sepsis in some cases. Because of this, immunization against organisms that cause pneumonia is a primary method of preventing sepsis. Infections from catheter and IV use are also a major cause of sepsis, so aseptic/sterile technique and hand hygiene techniques are essential. Clinical manifestations or signs and symptoms that you may notice in your patient. Clinical manifestations of sepsis include tachycardia, fever, peripheral vasodilation, agitation, confusion, unresponsiveness, and septic shock. Patients in earlier presentations of sepsis may have fever or hypothermia, tachycardia, and tachypnea. Severe sepsis then causes altered mental status, oliguria or anuria, hypoxia, or cyanosis. A patient with septic shock meets all of the criteria for sepsis, along with needing vasopressors to maintain a mean arterial pressure of greater than or equal to 65 mmHg and a lactate that is greater than 2 mmol per L. Early signs of septic shock are normal blood pressure to hypotensive, elevated pulse and respirations, warm and flushed skin, alert and oriented but anxious, chills, weakness, nausea, diarrhea. Later signs are hypotension, tachycardia, arrhythmias, rapid, shallow, and dyspneic respirations, decreased cap refill, mottled skin, lethargic to comatose mental status, and then oliguria or anuria. For the nursing assessment, sepsis affects the entire body, and nursing assessment typically includes continuous monitoring of vital signs. Also, monitoring of the hemodynamic status by use of CVP monitoring device or pulmonary artery catheter. Focus assessments are enacted to monitor the adequacy of ventilation, perfusion, and renal function. To check perfusion and cardiopulmonary function, a nurse should assess pulses to determine if they are rapid, weak, thready, and present in all extremities, capillary refill, and lung bases. There are further notes about nursing assessment on another slide. For labs and diagnostics for your patient with sepsis or septic shock, there are quite a few. You want to check blood glucose, so they may have hyperglycemia, which is a glucose level more than 120. They may have leukocytosis, because of course that is signs of infection because the white blood cells are high, or leukopenia, which is there are less white blood cells. They might have a high C-reactive protein level because of the increase of inflammation. With the PaO2, the FiO2 will be less than 300. Issues with coagulation. INR is more than 1.5 or PTT more than 60 seconds. thrombocytopenia, so a lowering of their platelets, or lactic acidosis. The specific diagnostics are going to be a complete chemistry panel with liver function tests, disseminated intravascular coagulation panel, arterial blood gas, blood cultures, chest x-ray because it might reveal signs of pneumonia or ARDS, ultrasound, CT scan. It can scan the abdomen for abscess, perforation of bowel, or ischemia. So it can scan for signs of like what caused the sepsis. For the pharmacology, antimicrobials are the primary pharmacological treatment if the infection is caused by bacteria or fungi. Broad-spectrum antibiotics are generally used at first until blood cultures come back and more targeted therapy can be used. As antibiotics take effect, the patient may face worsening condition as toxins are released into the blood from the destruction of pathogens. When fluid replacement alone does not reverse shock, vasoactive drugs and inotropic drugs may be used for treatment. These drugs increase venous return by vasoconstriction of the peripheral vessels. Caring for your patient with sepsis, also nursing interventions. Monitor their skin color, temperature, turgor for dehydration status, and moisture. Monitor the patient's cardiopulmonary function by assessing blood pressure, rate and depth of respirations, lung sounds, pulse oximetry, and peripheral pulses. Monitor the patient's body temperature, assess patient's mental status and level of consciousness, place patient on high-flow oxygen such as 100% non-rebreather face mask, maintain patent IV access, and apply pressure to bleeding IV sites. Sepsis and septic shock can be devastating, and there are many complications. Some of these include ARDS, acute or chronic renal injury, DIC, mesenteric ischemia, acute liver failure, myocardial dysfunction, and multiple organ failure. For patient education, advise your client to seek early medical attention at the first sign of an infection. Some of these signs are swelling, localized redness, foul-smelling drainage from a wound, urinary frequency, and burning. Instruct the patient to finish the entire course of antibiotics, even if they feel better before they take the last dose. Because if they don't, they can allow the bacteria to get stronger. And if they get stronger, it will take more drugs to treat them as they become resistant. These are my references. I got most of my information from Pearson, but I also utilized ATI and then a medical journal on septic shock. Thank you.